everyone, this is Dr. Scott back here with your next tip from Healthy You. So in this video, what we're going to talk about is how do we go safely from sitting to standing. It sounds trivial, but when you realize that the way that we get up and down are things that we have done many thousands of times in our life, and oftentimes these little things that we're not aware of lead us to injuring our back and putting ourselves chronically in positions that put us at risk for further injury. So when we look at the posture that we want to be in the video before we talked about how we hip hinge. Well, we actually go from sitting to standing using that same exact posture. So what we do is, say for example, we're going to get in and out of a chair or get in and out of bed. Here's what we're going to do. We are going to put our heels as close as we can to the chair that we're going to sit against. And then what we do is if we need to, we can use our hands as a counterbalance. We pull ourselves backwards into the chair and sit down. Now, when you go from standing, what most people will do is they have their feet too close together, which forces us to use our back. And watch what happens to my spine. So my feet are close together like this, right? Good posture for what we're taught for sitting upright in school, but bad when you have to go from sitting to standing. So when you do this, you actually have to round your back out to go to a standing position. What you should do is repeat that posture, hips wide, pull yourself down, and then repeat the same posture coming up. Drive your heels into the ground. So I can actually do this with my toes lifted because the weight is going into my heels. I have myself in an upright posture, chin straight, spine straight. Use my hips to push myself up. Exact same posture I use in the hip hinge that we demonstrated for lifting. My spine stays completely neutral and there's no risk for injury from the start.